Good day. I am Tristan J. Sumalbag and I am a student nurse from Wesleyan University, Philippines. And now we're going to do is applying transdermal patch. What is the purpose of this? Is it one, deliver medication, two, used to deliver hormones, narcotic analgesic, cardiac medication, and nicotine. For the assessment, first thing to do is uh, we need to assess the following: the patient allergies, the expiration date before administering medication, review assessment laboratory, uh, review assessment and laboratory that data that may influence the drug administration. Uh, Also assess the site should be clean and free of hair. Next is let's proceed to the planning. First, prepare the needed materials. First one is the medication patch, gloves, scissors, wash cloth, soap, and water. Also, we need to add the patient chart or the medication administration record and other additional PPE. Next is let's go to the procedure and implementation. First things to do is to gather equipment, check medication order against the original order in the medical record. Uh, Check the patient's charts for allergies. Next is perform hand hygiene. And 16, prepare medication per patient. Prepare medication for one patient at a time. Check expiration dates and perform calculations if necessary. Identify the correct patient, complete necessary assessment before administering medications. Check patient for allergies and explain the purpose and action of each medication to the patient. Put on the gloves, assess the patient's skin where patch is to be placed. Looking for any signs of irritation or breakdown, site should be clean, dry, and free of hair. Rotate applications sites. Remove any old transdermal patch from the patient's skin. Fold the old patch in the half with the adhesive side sticking together and discard according to the facility policy. Gently wash the area where the old patch was with soap and water. Remove the patch from its protective covering initial and write the date and time of administration on the label side of the patch. Remove the covering on the patch without touching the medication surface. Apply the patch of the patient's skin. Use the palm of your hands to press firmly for about 10 seconds. Do not massage. Remove gloves and additional PPE use. Perform hand hygiene. Document the administration of the medication immediately after administration. Next is evaluate the patient's response to medication within the approach of time frame. Next that we're going to do is the clean catch or midstream urine collection. What is the purpose of this? First is to minimize the contamination of the specimen by organism of the skin. 2. Confirm alteration in metabolism, infection, and fluid volume problem. 3. To determine appropriate antibiotic to administer to specific patient. What are we going to assess? First thing to assess is the doctor's order, client's level of consciousness, and level of knowledge and understanding. Ability of the client to collect their own urine. Next is the planning. Gather the following materials. Properly labeled specimen bottle, soap, washcloth, antiseptic swab or cotton balls, bedpan, non-sterile gloves, bed protector pad, Proceed. Next is the procedure and implementation. For patient who has ability to collect their own urine, simply give the specimen bottle to the patient to be used for urination, as well as the soap, washcloth, and antiseptic swab or cotton balls. Instruct the patient to wash or wipe with disinfectant the vagina or the penis before urinating in the specimen. When opening the cover of the patient, of the when next is when opening the cover of the specimen bottle, instruct the client to be careful not to touch the lid of the specimen bottle. When urinating, place the specimen bottle during the middle of the voiding under the stream of urine. Try to collect at least 2 tablespoons of urine. Once completed, cover the container and wash their hands. Send the collected urine specimen immediately to the laboratory together with the properly filled up laboratory request. Next is for the patient who has no ability to collect their own urine. The nurse will simply identify the client, explain the procedure, provide for client's privacy, set the bed to comfortable height to work, and lower the side rails where you will work. Wash your hands and arrange the materials, and then wear gloves. Place bed protector pad under the client's buttocks. Position patient and place bedpan under the client's buttocks. Wash perineal area with soap and water, then pat it dry. Clean the genitalia with cotton balls soaked in an antiseptic solution. For female client, wipe from front to back. For male client is clean the tip of the penis circularly. Next is ask the client to void. For female client, while begins voiding, the healthcare provider will hold the labia with the dominant head. 14. After the stream of urine begins, obtain 30 ml of urine specimen for routine urinalysis. 5 to 10 ml for culture and sensitivity test. Next is remove the container before client stop voiding. Allow client to complete voiding and wash the perineal area of urination complete. Remove bedpan and bed protector pad. Discard used materials. Provide for client safety, comfort, and privacy. Remove the gloves, wash the hands, and send specimen to the laboratory together with the properly filled up laboratory request. Next is evaluate client's response to the procedure and document the procedure and the other important data on client's chart. Next is we're going to do the 24-hour urine specimen collection. What is the purpose of this? First is to provide means to detect the concentration of dilution of urine, to check the function of the kidneys, to measure any products present in the urine, and next is the assessment. You need to assess the following: the doctor's order, client's level of consciousness, and level of knowledge and understanding. Assess also the refrigerator if functioning well. Next is the planning. Gather the following materials: specimen bottle. Next is the sign of the urine collection in progress, additives if required, preservatives, and refrigerator. Procedure is identify the client, explain the procedures, and place sign in client's bathroom stating that 24-hour urine collection is in progress with date and time. Discard the first void urine. Instruct the client to start voiding to the specimen container, usually in the morning, according to the policy, and store it at a cool temperature or refrigerate. Label specimen, therefore, until the same time on the following day. After the last voided specimen is placed in the container, cover and send the entire specimen to the laboratory promptly following the agency protocol. Always wash hands and wear gloves before the collection of the specimen. Remove signs and in the bathroom to inform the client the procedure is completed. If the specimen is accidentally discarded, obtain a new container and note a new date and restart the procedure. Evaluate physical response of client, specimen, and laboratory requisition. Next is document the procedure and other important data on the client's chart. Thank you.